So common diseases and disorders of the muscular system. Duchenne muscular dystrophy, or DMD, is caused by the inability of the body to make dystrophin, a muscle protein. This causes the muscles to become weak as the person ages. This disease primarily affects boys, and signs and symptoms typically present before the age of 5. Signs and symptoms may include frequent falls and trouble keeping up with the peers. Since all muscles are affected, the person will eventually require a wheelchair and assistance with breathing. Cerebral palsy. Cerebral palsy is caused by an interruption to the normal development of the person's brain, leading to weakness with muscles. Depending on the area of the brain that is affected, signs and symptoms will vary in the type and severity between individuals. Balance and coordination are often challenging due to the inability to control muscles. Carpal tunnel syndrome. Carpal tunnel syndrome may present with pain, numbness, or weakness to the hands caused by pressure on the median nerve. Some causes for this pressure are work-related, such as keyboarding with improper body mechanics, illness such as arthritis, and even pregnancy. Paralysis. Paralysis is the loss of strength and control of the muscles and parts of the body. Paralysis can be localized where it affects specific areas such as the face, feet, vocal cords, or it can be generalized where it affects a larger area of the body. There are various types of generalized paralysis, including paralysis, a partial paralysis wherein there is still some control of the muscles; paraplegia, paralysis that affects both legs and lower part of the body; quadriplegia, which affects both arms, both legs, and sometimes from the neck down; hemiplegia, which affects one side of the body. Sprain and strain. A sprain is an injury to a joint whereby a ligament is stretched or torn. A strain is an injury to a muscle whereby a tendon is stretched or torn. Diagnostic procedures. Electromyography, or EMG, is a procedure that assesses the function of nerve cells that control muscles. Electrodes, either attached to the skin or inserted into the muscle, allow for the recording of electrical impulses. EMG can indicate functional problems with the peripheral nerves, muscles, or with the signals between the nerves and the muscles. This is just one test in a series of tests that assist in the diagnosis of neuromuscular disorders. MRI, magnetic resonance imaging, is a test that uses radio frequency waves and a magnetic field to produce clear images that aid in the diagnosis of a wide range of conditions. Medical specialties related to the muscular system. Orthopedic surgeon. Orthopedic surgeons are medical doctors who complete an additional 5 years of specialized training in the prevention, diagnosis, treatment, and surgery of disorders and diseases related to the musculoskeletal systems. Neurologists. Neurologists are medical doctors who complete an additional 5 years of specialized training in the prevention, diagnosis, and treatment of disorders and conditions related to the brain, spinal cord, nerves, and muscles. Kinesiologists. Kinesiologists are regulated healthcare professionals with a 4-year degree in kinesiology or related discipline. They must be registered and in good standing. They work in a variety of settings that assist people with pain management, injury prevention, and health promotion through biomechanics. Muscular system vocabulary. Antagonistic, in opposition to each other. Cardiac muscle, the heart muscle also known as the myocardium. Its appearance is similar to skeletal muscle. It pumps blood and gives the heart beat. Electromyography, or EMG, measures muscle response or electrical activity in response to a nerve's stimulation of the muscle. Fibromyalgia, pain in the fibrous tissues of muscles. Hemostasis, biological processes that result in stable equilibrium. Hemiplegia, paralysis that affects one side of the body. Magnetic resonance imaging, or MRI. Radio frequency waves in a strong magnetic field provide clear and detailed pictures of internal organs and tissues. Myasthenia gravis, grave or serious muscle weakness. Paraplegia, paralysis that affects both legs and lower part of the body. Paresis, a partial paralysis wherein there is still some control of the muscles. Quadriplegia, affects both arms, both legs, and sometimes from the neck down. Skeletal muscle, also known as striated muscles. Skeletal muscles are responsible for voluntary muscle movement. Smooth muscle, also known as visceral muscles. Smooth muscle is mainly associated with the walls of internal organs. Smooth muscles are responsible for involuntary muscle movement. A sprain is an injury to a joint whereby a ligament is stretched or torn. A strain is an injury to a muscle whereby a tendon is stretched or torn. The muscle is one of 4 primary tissue types of the body, and it is made up of specialized cells called fibers. The body contains 3 types of muscle tissue: skeletal muscle, cardiac muscle, and smooth muscle. All 3 muscle tissues have some properties in common. They all exhibit a quality called excitability, as their plasma membranes can change their electrical state from polarized to depolarized and send an electrical wave called an action potential along the entire length of the membrane. Fascia is a fibrous connective tissue that encloses muscles. There are 3 types of muscle tissues: skeletal muscle, which is closely associated with the skeletal system, also known as striated muscles, and are responsible for voluntary muscle movement, such as swallowing. Smooth muscle, which mainly is associated with the walls of the internal organs, also known as visceral muscles, and are responsible for involuntary muscle movement, such as breathing. Cardiac muscle, which is heart muscle or myocardium. Its appearance is similar to a skeletal muscle and is responsible for the pumping of blood. It gives the heartbeat. Skeletal muscles act not only to produce movement, but also to stop movement, such as resisting gravity to maintain posture. Small, constant adjustments of the skeletal muscles are needed to hold a body upright or balanced in any position. Muscles also prevent excess movement of the bones and joints, maintaining skeletal stability and preventing skeletal structure damage or deformation. Skeletal muscles are located throughout the body at the openings of internal tracts to control the movement of various substances. These muscles allow functions such as swallowing, urination, and defecation to be under voluntary control. Skeletal muscles also protect internal organs by acting as an external barrier or shield to external trauma and by supporting the weight of the organs. Skeletal muscles contribute to the maintenance of homeostasis in the body by generating heat. This heat is very noticeable during exercise, when sustained muscle movement causes body temperature to rise, and in cases of extreme cold, when shivering produces random skeletal muscle contractions to generate heat.